But I guess here's what I've struggled with this whole idea of the models, like the University of Washington model. They don't take into account at all what the cost of the various containment strategies are. They just say, look, if we do these things, it's going to result in this fewer cases. And that's kind of driving the policy right now. But how do we incorporate, how do we think about, here is the harm that's being done by these versus the harm that would be done if we didn't do anything. And I don't see that we've got a framework for thinking about those kind of decisions yet. What are your thoughts on that?
I agree with you. I'm not sure that we have a framework for that yet. And one of the biggest challenges that we face is that, Texas ranks 47th in testing. So we're not testing enough people in order to get that top of the funnel number, a universe of how prevalent COVID-19 is in our community. And we're fortunate that, our hospitals haven't been overrun, and we're fortunate that that it hasn't summed up to the worst possible predictions that are out there. But we do know that it's here. So there's some corroboration that this isn't a myth. But I think it would behoove us to have better testing and more coordinated testing across the state and across the country to better compare regions and understand which models apply to what regions, because Houston's different than Minneapolis, which is different than New York. And Bill, you and I have talked about the differences in culture between, say, New York and Houston versus getting on the subway versus getting in your car. And I think that it's really important to have a baseline standard of incidents per capita and then start to look at some of the cultural differences and the social differences that may lead to more transmission of the virus versus less transmission.